This program is brought to you by Community Trust Bank, Medical City, Bid Select, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Welcome back, everybody, to Platforms, a life-lifting news program for women. Continue our conversation with Dr. Kathryn Waldrep. She's a gynecologist here at Medical City, Dallas, and we've been doing a beautiful overview on procedures relative to minimally invasive surgery. Dr. Waldrep, let's talk about an area that you deal with a lot. It's called endometrial ablation. What is that condition?
Well, endometrial ablation is another option to treat menorrhagia, or menorrhagia is known as heavy bleeding or long periods. Some women have really heavy bleeding or long periods where they're maybe bleeding for a week or a week and a half, or having to change tampons or pads every hour to 2 hours during their period.
What causes that? Is that a genetic thing? Or?
Not really a genetic thing. Sometimes it's because they have these fibroid tumors. Sometimes their uterus is just enlarged and we don't have a good reason for it. Sometimes they have a condition known as adenomyosis, where the endometrial glands are actually in the muscle wall of the uterus. And so one of the ways that we can treat this, if a woman doesn't want a hysterectomy, is that we can do what's called an endometrial ablation. This is another form of minimally invasive surgery. We've talked about the laparoscopic, but this is where we go in and we actually go inside the uterus. So it's done vaginally, and there is a wand, or sometimes we use a balloon and go up inside the uterus, and we ablate the lining of the uterus. And it kind of, if you
when you
want to
say
think
ablate,
of,
what do you mean by that?
Like burn off or get rid of the whole lining of the uterus. And when we do this, we can do it in our offices sometimes, and sometimes we'll do it as a day surgery procedure. But this will either have a woman have no periods at all, or she may have very light periods.
It's really life-enhancing surgery, though, because
it is.
It's miserable having to deal with that.
Right. So for some people, they'll either go back to having just normal type periods or no periods. So it's a great benefit. And the nice thing about it is that they can go back to their normal activities the next day.
Wow.
Yeah, wow. That is just great. So endometrial ablations have been a real boon for women because they don't have to have a complete hysterectomy. Right. So it's not right for everybody, but for the right candidates, it works great.
You bet. And there's another area you've talked about called artery embolization.
Uterine artery embolization is something that's been relatively new, and it is done by interventional radiologists. And they go it's usually for women who have uterine fibroids, and what they do is they go into the femoral artery, and they put kind of like a plug in to the blood vessels that supply the blood to the uterine fibroids. And these little coils that go into the blood vessels that supply those fibroids. And then if you can block the blood flow to those fibroids, they will start to die off or regress in size. And so it works reasonably well for probably about 70% of women who have fibroids. There's some downside to it. You don't really get pathology. There's, I would say, a relatively high reoperation rate, but for some women it works pretty well, and it keeps them from having to have a hysterectomy. So that also is another option.
Right. Let's talk about why you chose the field that you chose to study as a physician. Why OB-Gyn? What appealed to you about that?
Oh, I love working with women. I just think, women tend to know their bodies well. And if a woman comes in and says she has a problem,
she senses something.
Yes, she senses something's wrong. She usually really has a problem. And to me, it's just a joy to deal with women and work with women on a daily basis. So I really enjoy it.
What would you say are some of the more common scenarios you see with women today relative to the gynecological side of your practice?
We work a lot with women who have, the issues we've talked about. And then another thing that we haven't covered but is stress urinary incontinence and uterine prolapse. Once women have had children, a lot of times they'll have problems with urinary incontinence. and that's from having carried around big babies. And so we treat urinary incontinence, and we can also do that relatively minimally invasive. If they don't respond to doing Kegel exercises or what we call pelvic rehab, then there is a sling type surgery, which is a little sling that goes under the mid-segment of the urethra. So we can do a little sling. This is the bladder here. We can put a little sling, which is a little piece of mesh that goes under the mid-segment of the urethra. It forms like a backboard so that they don't leak urine anymore when they exercise.
For urine.
That's right, when they exercise or cough.
Yeah.
So that's great, for women who have been having to cross their legs or kind of double up every time they cough or sneeze. Well, we can fix that. And then we see women who just all of their organs are falling out. They've had so many children, and we'll actually have women who the whole uterus and cervix is actually prolapsing outside of the vagina. And we now have what we call these kits, which are kits that are mesh kits, and we can actually go in and put everything back where it belongs. And I love doing that type of surgery. It's just, to me, being able to restore pelvic anatomy and put the bladder back where it belongs and the rectum back down where it belongs and get everything back in working order is great.
Beautiful.
And so, there's some disadvantages to that. You can have erosion of mesh, and I mean, there's nothing that's absolutely ever perfect or foolproof in surgery. But when you can kind of restore a woman's life that way, it's great.
It's all about quality of life.
Right.
We've got a little under 2 minutes, Dr. Waldrep. What advice would you give women, our viewers out there, in terms of maintaining a very healthy lifestyle relative to their gynecological health? I'm impressed I got that on the first
You did
try.
good. That was very good. Oh, I think all of us need to exercise. Obesity really contributes to prolapse. It contributes to stress incontinence. So women who are overweight are going to have a lot more problems.
Issues, yeah.
And women who are overweight are harder to operate on as well. They have more complications with surgery. It's harder to do laparoscopic surgery on really heavy women. So certainly the better shape we all stay in, the easier it is to take care of our bodies in every way.
Well, Dr. Waldrep, it's been an absolute pleasure having you on the show. This fascinating topic. We got really in-depth and got some great information. If our viewers want to get a hold of you or learn more about your practice, what's the best way to get a hold of you website-wise?
Our website is Vernon Waldrep.
VernonWaldrep.com. And they can also go to the Medical City Dallas and get more information from you there.
Yes.
Thank you so much. It was terrific. Ladies and gentlemen, this is Siobhan Palmer with Platforms, a life-lifting news program for women. We'll be back in a moment.